It's ingrained in us that we are the caregivers and we have to be available and to say yes. And if we say no, then somehow we're being selfish and not being a team player or things like that. And that has to change, because if we talk about burnout and things that contribute to a physician or healthcare professional experiencing symptoms of burnout, always being available, no boundaries, is a big component of burnout. Did you experience any symptoms of burnout during your years of practicing?
Yes, absolutely. Initially, not so much. Definitely more as time went on. I think for me, my issues were that I did not set boundaries. I was very poor at setting boundaries with my patients. I would spend time lying in bed with my computer on my lap answering people's messages at night. I also gave some patients my phone number so they got a hold of me at home. So there was very poor boundary setting. I felt that was probably the biggest contributor to the feeling of burnout, plus the unbelievable workload demands that we had placed on us, needing to call the insurance companies for prior authorization, having to put orders in the computer. All of that really led to a sense of disillusionment with the career of medicine and a feeling like I wasn't giving my patients what they really needed. I didn't have the time to sit down and really spend time with them and really hear their concerns in a way I wanted to, and felt like they deserved to be heard. So for me, for sure, towards the end, each day I just felt anxious. I just felt an uneasiness. I would go into the room with a sense of dread, like, how am I going to do this? How am I going to be able to take care of this person in the way they deserve, in the time I've been allotted? And I don't think it's possible. So I felt a tremendous sense of disillusionment by the end.
Yeah. And when we talk about these symptoms of feeling disillusioned, anxiety, and other mental health issues that many healthcare professionals experience, yet don't seek help for, what do you think some of those barriers are to seeking the care that they need?
Yeah, that's a great question. I think that there are a couple of reasons. Regarding mental health, I think there's still a lot of stigma around mental health and substance use disorders in the medical community. There's some studies. I know in one study, 50% of female physicians didn't seek treatment despite feeling that they met the criteria for a mental health disorder, which is terrible. And why aren't they seeking treatment? I think because of the stigma. And number two, I think because of fear around medical licensing and the state boards. There are questions on those licensing applications, and states differ from state to state, but there are questions around, have you ever had a mental health disorder? Have you sought treatment for a mental health disorder? Do you have a substance use disorder? Have you had treatment for a substance use disorder? And there's tremendous fear around the repercussions of answering yes to that. And that is a barrier then to people seeking the treatment they need. It's a huge problem because suicide is at a rate of, I think, 400 physicians a year are committing suicide. So this is something that we really need to address. It's a tremendous issue in the medical community. I think a lot of it is around the licensing issues, but also it's around stigma.
For us, by us, and just for us, this is Hope for Med.